For this week, for our module week 5, we focused on solution-focused brief therapy and narrative therapy. When looking at the similarities and differences between the two therapies, it is evident that they are both very solution-oriented and very positive-oriented for the client and the counselor. The counselor and client have a positive relationship and a working relationship to create positive change in the client's life. However, for solution-focused brief therapy, it is noted that it is more it's less like collaborative than narrative therapy. Narrative therapy really has the counselor and client engaging and working together, working through the client's life and life experiences to create those goals. Whereas for solution-focused brief therapy, the client is choosing their own goals that they want to accomplish themselves and telling the therapist, and they work towards that together. A similarity is that they are both have an optimistic view of clients and people in general, and they kind of give them a more positive and optimistic view and say that, people generally want to live good lives, they want to make good decisions, and there is no judgment. This is specific for narrative therapy and plays into SFBT therapy, where there's no judgment with the client. The client should feel open to speak to the therapist about whatever they are feeling or thinking, and that contributes to the positive growth in that client's life. Another difference shares that narrative therapy considers listening to the client's past, whereas SFBT therapy really wants to hone into the future and the present life of the client, whereas narrative therapy does take into consideration those life stories from the past and really try to figure out how, the client felt resourceful in that time and how to use that to, motivate positive change in the client's life. For the second portion of this discussion, when focusing on strengths and limits of both therapies, for solution-focused brief therapy, there is a strength that clients are helped to feel more empowered in their life, as though they have control and they are strong enough to make those decisions in their life and to make that positive change. This is a very big strength, as it really helps clients to feel that they can actively make those changes inside and outside of therapy. However, a limit to SFBT therapy is that there is not a big focus on diagnosis and medical considerations, which might be risky for some clients that do have clinical diagnoses and need, medication or other more cognitive-driven techniques to help them with their diagnosis. This form of therapy also really uses the client to share that they are the expert of their own life. However, that can in some cases make clients feel that the therapist isn't confident in making decisions or leading the therapy, and it could be taken the wrong way, possibly during counseling sessions. For narrative therapy, there is also the strength of empowering clients to make those decisions and make those life changes and give confidence to the clients. It is also a really relevant therapy for working with diverse cultures and diverse clients, and it focuses on various contexts of clients' life, which is positive as well. It is shared that for narrative therapy, they focus on social, cultural, political, and relational context, just outside of focusing on the individual. And this is really great for working with diverse clients, as it looks at different factors of the client's life, such as gender, ethnicity, race, sexual orientation, disabilities, and all other factors that hone in and impact clients' lives. When moving towards Christian concepts, Paul shares verses that relates to the two therapies, and that it is clients should focus on, and people in general should really focus on what is working in their lives, what is making that positive change in their lives, and should hone into that through God leading them to make those positive decisions. These two forms of therapy kind of relate to that, in which the client is guided to look at what is working in their life and to feed into that and to use that to impact their life outside of the therapy and their lifestyle choices. However, there are also limits with case conceptualization for these two theories. It's difficult and there are limits for making measurable outcomes, and this impacts the whole case conceptualization and where the therapy is going to go. Both therapies do not rely on a strong medical aspect or diagnosis, and this can create limits for creating measurable change. In addition, both therapies, SFBT therapy in specific does not look at the past too much. Clients can openly talk about their past, but it focuses more on the future of their lives. This can create difficulty because in order to get a really complete case conceptualization, there needs to be focus on both the past and present life of the client. So in therapy, it needs to be kept in mind that in order to get a full picture of the client and to create those measurable outcomes, that there needs to be observation in both the past and the present and future life of the client. Thank you for listening to my video for this module week.